Good morning. I'm Kristen Askelson, Managing Editor of the Acadiana Advocate, and this is our mid-year Economic Outlook Summit. Now, we've had these summits before, and they looked a little different, but like everything else in 2020, this one's going to be virtual so that we can all stay safe. In the past, we would gather for coffee and conversation with experts from different industries and talk about the economy, but today we're gonna join you virtually in your living rooms to discuss the economic impact of coronavirus on the Acadiana regional economy and what lies ahead. So my colleague Adam Daigle, who is the Acadiana business editor, and I are going to be your hosts for about the next hour. We'll start with a presentation. We'll start with a conversation with an economist who will sort of paint the picture for you of the effects of coronavirus on businesses and economic activity in the area. And then we're going to switch gears, introduce the rest of our panel to have a conversation about what they're seeing in their industries and where we go from here. And then it's gonna be more of a conversation. We have some questions that we've solicited from the public that we're gonna be asking our panelists. But before we go any further, I have to acknowledge that this event would not be possible without the help of our sponsors. And so I would like to thank Hancock Whitney Bank, Acadian Companies, and AARP for partnering with us on this extremely important topic. So first up is Gary Wagner, a professor of economics at the University of Louisiana at Lafayette. His role at UL includes providing research, forecasting, and outlook reporting on the regional economy. So Gary, we've had you in these summits in the past, and I think you do a really good job at taking a lot of dense economic data and sort of breaking it down for us in a way that we can understand and that is relevant. So I was hoping you could start by just giving us a snapshot of how the pandemic has affected the Acadiana economy from March until today.
Sure. Thanks. It's a pleasure to be with you. And I just want to thank you for the invitation to be here. I also want to thank the sponsors and thank the viewers for taking time out of their busy day to listen. So what I want to do is just try to give you a broad sense of what's been happening in Acadiana. It certainly doesn't take an expert to know that when you're outside of your home and you're grocery shopping, things look a little bit different today than they did in February. And in fact, we see that in the data, and the experts today are really going to talk about what we're seeing in their particular industries. But to give you a broad sense of what's happening, if we go back to February 2020, we had about 202,000 people that were employed in the Acadiana region. So that's the 5-parish region that's considered the metro area. In April of 2020, that number was down to 178,000. So that was a decline of 12% in a period of 2 months. So that's the largest drop, and the largest drop in percentage terms that the area has ever experienced going back to 1990, which is as far back as these data go. We saw the same thing at the state level as well. So between February and April statewide, we saw job losses of 14%, which coincided with the stay-at-home orders that were put in place by the governor to fight the pandemic. Also, what's probably not surprising to most people is that those job losses are really heavily concentrated in the service industries. In particular, they're concentrated in accommodation and food services, and then also in retail sales. And those two sectors are really important for the state. They're important for Acadiana. They're particularly important in the New Orleans region. And those two sectors alone account for more than 50% of the job losses that we've seen in the last couple of months. I think the other thing that probably is not helping the Acadiana region in particular is that the overall slump in economic activity that was created by the pandemic is not helping the oil and gas industry. I mean, the oil and gas industry was, I guess the best way I would describe it is probably limping into 2020. We saw oil prices fall pretty sharply at the end of last year. We had just seen in our region oil jobs start to pick up just a little bit late 2019. And so I don't think the industry was in a really good position at the beginning of the year, so certainly the pandemic didn't help. There are, however, I think a couple bright spots for the region that I also wanted to point out. Home price growth has actually been really strong, so the local housing market is doing really well. In fact, over the last 9 months, we've seen the strongest home price growth in Acadiana of any time going back to 2007. In fact, in the first quarter of 2020, so this is actually including March of 2020, home prices were up 4% year over year. That's only slightly below the national average and the second fastest in the state. So the housing market is certainly helping what is a very difficult time for a lot of people. I think the other point to be optimistic is if we look at job growth in the region between May and June. So this is the time where we started reopening the economy. Now we've shifted back into phase 2. But when the governor initially allowed the economy to reopen, we gained almost 9,000 jobs between May and June. That's a really, really large number. To put that in perspective, we would gain about 1,000 jobs during a quote unquote normal good time. So we were about 9 times that rate. And I think the reason why we can be optimistic about that is once we get to a point where we feel like we have control of the virus from a public health perspective, and we start to open the economy up again, that was certainly a sign that it looks like the recovery could happen very quickly. And I think that that's something that we're probably all very hopeful for. But I think overall, I hate to use the term unprecedented because I think it is probably used a little bit too frequently, but I've been studying economic data for more than 20 years. And basically, when you look at any of these kind of metrics at a regional level, at a state level, at a national level, we are seeing things that we have just never seen before. And I think what that also means is there's a lot more uncertainty now about what the future might look like than what it did in the past. I remember, sitting at the summit in January, thinking we were going to have job growth of, probably about 1%. And I don't think I've ever given a forecast that was more incorrect than what I did in January. So I think there are reasons to be optimistic, especially when the recovery starts. There are a couple things that I'm concerned about that I think we'll probably hit a little bit later in the presentation. But for now, I think, we took a pretty serious hit. The state took a pretty serious hit. The nation took a pretty serious hit. And I think that once we get this controlled from a public health perspective, I'm optimistic that things can turn around a little bit quicker than what we've seen in the past.
Well, that's kind of great news because we haven't had a lot of optimism in recent months. So I'm glad to hear you say that. A lot of times people like to put things in perspective. So people will, especially around here, they talk about previous oil slumps. And they also talk about, what happened in 2008 with the housing crisis nationally. How does this compare in your mind with those?
Yeah, every sort of recession that hits a local area is a little bit different. Just to kind of put this in the numbers in perspective, the job losses that we've just seen because of the pandemic are an order of magnitude larger than any recession or oil and gas slump that we've seen in our region or statewide. Mm-hmm. If you go back, some of the numbers I'm going to use here are statewide because we don't have local data going back as far, but the unemployment rate in Louisiana previously had peaked at 13% in the mid 80s due to the oil market crash that occurred then. We were almost at 14% because of this. So the unemployment rate in Lafayette now is 11.6%. It was 13 last month. That's the highest we've ever had going back to 1990, which is as long as the data have been calculated. So I think to compare this, that's what I'm saying. The numbers and everything we look at are really out of scale because we just haven't observed contractions in economic activity of this magnitude, in any time in the last 100 years.
How it's looking a little more narrowly at Acadiana, how did we do compared to the rest of the state over the past, 4 to 6 months?
Actually, Acadiana was doing pretty well compared to the rest of the state for the last 4 to 6 months. The region took a big hit in 2014, 2015 when oil prices slumped. The industry contracted and lost about half of their jobs. So they went from about 23,000 oil and gas jobs in our industry, in our area, to around 11,000. And that had started to tick back up in the second half of 2019. If you look at statewide over the last year, the economy was relatively flat. So in 9 consecutive months, job growth had been pretty much around zero. But there were 3 areas in the state that were more or less bright spots, and that was New Orleans, Baton Rouge, and Lafayette. So the areas where we had been seeing pretty strong growth in Louisiana were really occurring in those 3 markets. And so we were in a pretty good spot coming into 2020, especially compared to where we were in, say, 2016, 2017, when we were still kind of reeling with the after effects of the decline in oil prices.
Thank you. Don't feel bad about your January forecast because nobody saw this coming.
Thank you.
I appreciate you putting that into perspective for us. And I think we're gonna, I'm gonna let Adam jump into the panel discussion, but I want us to definitely come back and talk to you when we start talking a little more about recovery, because there are some things ahead that could potentially be roadblocks to recovery that I want you to weigh in on. So as you see, Adam Daigle, our Acadiana business editor, has popped up on your screen. So right now I'm going to turn the mic over to him, and he's going to get our panel discussion started.
Good morning. Thanks for everyone being here. My first question will be for Gifford Briggs. Gifford is president of the Louisiana Oil and Gas Association, LOGA, represents the independent and service sectors of the oil and gas industry in the state. And, Gifford, we've had some stories in recent weeks of bankruptcies and layoffs and that sort of thing. I guess I'm just kind of curious, should people think we're kind of the worst is behind us yet, or as far as job losses and bankruptcies and that sort of thing, or there's still more to come?
Well, thank you. Good morning, and thank you for having me on today and the opportunity to discuss the industry and the state of the economy. For the industry, there was some discussion of how this compares to previous recession. From the industry standpoint, when I talk to our members in throughout Louisiana and elsewhere, they say this is worse, a much worse situation than we even saw in the 80s. And really for industry, I mean, we've got, 251 rigs in the entire United States. We have 20 rigs running in Louisiana, 10 offshore. If you look back in the 80s, we had 30 or 40 rigs in South Louisiana alone, not counting offshore or North Louisiana. And so from a pure drilling standpoint, we're magnitudes less active right now just in Louisiana, and the same goes for the whole country. So when you look at, is this the end? Are we going to see more job losses or bankruptcies and consolidation? I think the answer is yes, until there's a rebound in the economy and demand is still down for oil globally. And so until that demand picks up, where companies are going out and starting to invest again and starting to drill and produce natural gas again at a level that was, I'd love to get back to just, January or February of this year. We're going to continue to see companies that don't have an avenue to sell their products. And for Acadiana, that is very heavily based in a service economy. That really is problematic going forward until we can see that rebound, which, some are talking 2021, 2022. I saw a number about the other day that says oil demand and travel won't fully rebound until 2024, which means that if that's the case, that Acadiana and the oil and gas industry are in for a rough ride.
All right. My next panelist is Ben Berthelot. Ben is president and CEO of the Lafayette Convention and Visitors Commission, oversees tourism promotion and marketing for all of Lafayette Parish. And my question for you, Ben, this morning is, we've reported job losses among hoteliers in Lafayette, and one hotel had to close. How has it been since then? In recent weeks, have any of the jobs come back, or is it starting to get a little bit worse?
Well, good morning, Adam, and thank you guys for having me on. I appreciate you recognizing once again the importance of the tourism economy. Immediately back in mid-March, there were layoffs, hotels down to skeleton crews. We have seen since May, once the economy started opening up, jobs starting to come back slowly. We're starting to see some of our director of sales positions being filled back that were furloughed, and so that's encouraging. And a lot of that has been as a result of the growth that we're seeing in our youth sports market. It's our fastest growing segment prior to COVID-19, when the governor opened up in phase 1 and allowed for youth travel sports to resume. That's when we began seeing some small growth starting to happen. That's when we started seeing employees being brought back on slowly at those properties.
All right, thank you. My next guest is Jennifer Clowers. Jennifer is Vice President of Vice President of Finance for Our Lady of Lourdes Hospital in Lafayette. And my question, Jennifer, is based about workforce. With the COVID situation worsening, how does healthcare kind of address this? Do you hire more people, or is there more people to hire? Are your people basically exhausted, and the front workers, are they being exhausted right now?
Good morning, Adam. Thanks for having me. Really, for us, it's a three-pronged approach. We are focused on supporting our team, maximizing our internal resources, and external recruiting. Our team is tired. They are exhausted. And so we work to find ways to support them emotionally and physically. We provide those that are working on our cohort units, those are the ones taking care of COVID patients, meals twice a day. We provide them with a service where they can get laundered scrubs so they don't have to take those scrubs home. We provide childcare subsidies and even hotel subsidies if they're not comfortable going home to their families. We also have focused on our internal nursing pool. Those are our nurses that are not traditionally at the bedside. Maybe they're in the recovery unit or a universal care unit. And so we've provided them with classes so they'll be ready to take on additional bedside roles when needed. And we maximize our resources across all of our campuses. Here at Lourdes, we have the Women's and Children's Campus and the Heart Hospital. And so we pull from those campuses as needed. We try to keep most of our patients that have COVID here on the Ambassador Caffrey campus. And then finally, we're focused on recruiting and external resources. We have a large new graduate class right now. Of course, it'll take until September to get those nurses trained up. We have what we call interim assignments, where nurses can take 13-week assignments, and we've increased that pay. And then, of course, we're trying to work with contract agencies to source nurses not currently in this market.
Thank you.
Hey, Jennifer, I have a follow-up question. You know, I know that, you know, your industry has been front and center the past few months. And a lot of, I know in Acadiana, at least in the past month or so, most elective procedures have had to be postponed because of the COVID numbers. So I'm just wondering if you guys are able to look at the curve, at the measures that are being taken, and if you have any idea when you might anticipate that normalizing a little bit and being able to do some more of those elective procedures.
Absolutely, Kristen. So to kind of give you perspective, when we were in phase 1, our highest census was April 11th, April 12th, and we had about 25 patients at that time. Yesterday, we had 81 patients. Last weekend, we felt like we were seeing a bit of a decrease. And so we had gotten down to 70, 71. It's funny, every morning we get a report, and everyone, first thing they do in the morning is open that report and see what is our number today. And so we were hopeful a week ago that number was beginning to come down. But unfortunately, as I mentioned yesterday, it's popped back up. So it really is hard to project. We do watch the number of positive cases overall, So we look at the Louisiana DHH website. If you ever go out to that website, it'll show you the positive cases. And we're hopeful that there's a trend in those positive cases overall beginning to decrease, that hospitalizations will eventually begin to decrease also. But we had also done a projection back in March and April and had thought this would actually be a little bit of a lag and we would see a surge more in September or October.
Mm-hmm. I know I do go to that website every day, way more than I wish I had to. And I know that the governor sounded encouraging yesterday when he suggested that Louisiana might be plateauing, unfortunately at a high number, but a plateau is better than rising. I'm going to turn it over to you in a minute, Adam, but I do have a question for Ben. You know, Lafayette we're all about our restaurants, right? We love our restaurants, we love our food, and I know that the summertime is typically slow for them, and so that's where Eat Lafayette was born, which is this initiative to sort of show some love to our local restaurants. Can you tell us a little bit about how that's going and how our restaurants are doing?
Sure. I mean, I think their struggles have been well documented. The national statistics from the Restaurant Association say that 1 in 4 restaurants will close nationally as a result of COVID-19. I think we've been fortunate a little bit. We haven't seen quite those numbers yet, and hopefully our restaurants can continue to hang on. But I think our entrepreneurial spirit that our restaurateurs and community has been on full display. That's helped out a lot. We hope that we're able to help a little bit with Eat Lafayette. We opened it up to all locally owned restaurants. We have over 230 restaurants signed up. Just yesterday, Waiter announced free delivery for Eat Lafayette restaurants. And so as we move through the phases, I think we all thought by this point we would be further along in terms of encouraging more people to dine in to the restaurants. Obviously, that hasn't necessarily been the case, and many of our restaurants are still pushing to go. So we've had to pivot a little bit in our messaging from what it typically is, but I think they're hanging on. But it's very important that we continue to support those locally owned restaurants, because those numbers that I mentioned nationwide are scary numbers. And like I said, fortunately, we've been able to hang on so far. And for that to continue to happen means our people need to continue to support those locally owned restaurants.
Thank you for that. I made a note: free delivery from Waiter for Eat Lafayette restaurants. Go ahead, Adam.
All right, my question's for Gary, and it's been debated almost ad nauseum, the federal unemployment benefit. Once that goes away or reduced, what have you, how will people see that as far as spending locally and I guess regionally and everything else? How big of an impact would that be?
It's going to have an enormous impact. As the law is currently written, it expires on the 31st of July. And just to give people some context for what this means, in Louisiana, the maximum weekly unemployment benefit that somebody could receive pre-COVID was $247 a week. The average was about $227 a week. And what the CARES Act did is provide an additional $600 weekly unemployment insurance supplement to that amount, and it expires, as I mentioned, July 31st. But if you look nationally, one of the things that I looked at is what fraction of wage income is coming from unemployment benefits. And normally that number is around 0.5%, which means nationally, unemployment benefits are not a big piece of wages and salaries for most people because most people are employed. In May of 2020, that number was 14%. It was 6 times higher than anything we'd seen going back. And these data go back into the 1950s. And so that's kind of an academic wonky way of me saying that unemployment benefits have never provided more income support to families in this country than they are right now, by a wide margin. And so if you just look at some of the numbers in Louisiana, we have about 400,000 people who are receiving this $600 benefit. So if their unemployment benefits drop from $827 a week to $227 a week, that's a 70% effective cut in their salary. You're talking about a reduction in potential spending power of about $240 million. In the Lafayette region, we've got about 15,000 people that potentially are receiving those benefits. I don't have the exact numbers. So we're looking at a potential loss in spending just in our own parish of almost $9 million. So what we're going to see is if that benefit level is not extended, you're going to see consumer spending, which makes up 70% of the economy. That's what really drives the economy. You're going to talk about household spending is going to drop very, very sharply because a significant number of people are going to experience a big reduction in their wages.
Wow, that's pretty sobering. My next question is for Gifford. We had some stories this last couple of weeks about offshore activities, some mergers. They've got a strong opinion about it either way, done or not doing it like that. What's the outlook out for offshore, and any optimism out there right now?
Matt, the challenge for offshore is the same that we have onshore, in that we've got a really low price environment with zero predictability in the future. And, offshore is even more difficult than onshore, whereas, if prices go up tomorrow, we can, get a rig out in the field and start drilling pretty quickly. Offshore, these are projects that require years and years of planning and investment to get to the point where we can finally actually start making the investment and producing oil and natural gas. And so when you look at offshore, the road to recovery there is a longer road to recovery. I mean, the good news is the oil and gas industry is not going anywhere. We have, outside of the hospitality industry, while we may have the largest job loss in the state at about 18% year over year, we know that people are not going to stop consuming oil and natural gas. We're not going to start powering our vehicles with it. We're not going to stop making products of it. So there is still going to be a need for the energy producers. The real question that we have as a state and as a community in Acadiana is that investment going to be here? Are we going to be making investments in Louisiana to drill and explore and produce oil and natural gas? We have abundant resources, but we've got a regulatory framework, we've got a legal framework, and we've got a financial framework that doesn't encourage investment. Representative Couson and Senator Henskins have done a good job as chair of the Natural Resources Committee in the legislature of trying and advancing policies that will try to attract investment, along with Representative Villiers and others. But we just haven't gotten the traction that we need, because eventually people will start drilling again. Eventually there's going to be investment. And if that investment ends up being in Texas and New Mexico and other states, these service companies are going to have to continue to ship more people, more resources, and likely eventually move out of state, which for Acadiana will be devastating to the economy. And so, what we need to do is figure out how we can attract those dollars, because we're going to have to compete harder and harder than ever before to get those dollars in our state.
Hey, Gifford, in the short term, we've seen in some other places where, especially in states that are heavily reliant on one industry, like the automotive industry, we've seen them be able to shift gears and sort of go outside the box, and an automotive plant might start making N95 masks, for example. I'm just wondering if they're within the oil and gas producers or the service industries, whether there's been any of that short-term diversification.
Yeah, I mean, I think companies are trying to look for ways all the time, and I think a lot of particularly on the refining side, the refiners that were didn't have a need to make fuel, and so they to the degree that they could began making products like hand sanitizers and others. I know companies across Acadiana that were donating PPE equipment, not that they could manufacture it, but what they had, they were donating to participate in the process. But, look, if you're a pipe supply company that has a drilling pipe, that's what you do. If you're creating blowout preventers and valves, like those products aren't necessarily, can't really be used anywhere else. And so, our industry is going to continue to innovate, and we're going to continue to take those innovations and apply them elsewhere. but so much of what we do is specialized that can. And then again, our industry is one of the highest paying industries in the state. So when someone loses a job making $100,000 a year, if they find another job in another industry, chances are it's going to make a lot less money than what they're making now, which only lessens the amount of dollars that are being spent throughout the economy.
I've got questions for Ben. I kind of feel sorry for the folks at the Cajun Dome. They can't hardly use their building. They had outdoor shows that were canceled, and I guess my question is, what can those folks do, or how can they kind of keep things going there without events? How do they kind of keep moving forward?
Yeah, I want to give you some numbers. I'm not sure if I'll get the opportunity, but I'll sort of set the stage and I'll answer your question. We've had year to date, as a result of COVID-19, lost business, 202 conventions, meetings, athletic events, and/or tour groups. That's 45,516 room nights, 537,894 attendees, for an economic impact loss of 54,750,000. That doesn't include leisure, doesn't include festivals. We know that Festival International has an economic impact of $50 million by itself. Does not include concerts at the Cajun Dome. And so they're in an extremely tough position right now, in that the majority of their revenue comes from events. And when you can't have an event in 5 months, then you have no revenue. And they've done everything they can. They've furloughed employees. They've laid off employees. They're down to a skeleton crew. The director is cutting grass, not too well, but she's cutting grass. It's a little high, but it goes to show you how serious the situation is. And they have been able to obtain a line of credit for $900,000, but they can't start spending that money until they know that they have events on the books that are going to drive some revenue. And so they're having some serious conversations. And just as of last week, the conversation of possibly having to turn the keys over to the university. And over the years, we've heard lots of different conversations about the subsidy not being enough and they need more assistance and those kind of things. But I've never seen, obviously, a scenario where they would have to turn the keys in. So the next couple of months, the fall, and the ability to get an event on the calendar is very important. And that's been the biggest challenge, is just the uncertainty. They think that an event's going to happen, and then all of a sudden somebody comes and says, no, it's not going to happen, as little as a few days out. And so, as you mentioned, they're in an extremely tough position, as are all of us and a number of organizations. But certainly the next 6 months are going to be very important, and the ability for them to actually host an event is going to be very important.
Yeah, that's the big question, isn't it? When will people be able to gather again? Right. Hey, Gary, I want to go back to something that you said a little bit earlier and see if you can explain it to me, because I've never understood the Lafayette real estate market. What do you attribute it to, the fact that it's so strong right now?
I should ask you that question. As somebody who moved here 2 years ago, I don't quite understand the real estate market either.
And what do you think that says, that the real estate market is so strong?
I think some of it, at least nationally, is people are probably looking to make investments in real estate because they realize things are changing. You might be spending more time at home. One of the things that I do know, looking at our market, just in terms of properties, the number of properties that have been listed for sale has actually been a little bit lower than what we normally see. And so when you see the supply being reduced, you're going to have a tendency to see prices being a little bit higher. I think also probably what's happening in the real estate market is it's transitioning as the region transitions and grows with oil and gas. So the real estate market, if you go back 20 or 30 years ago, would cycle pretty closely with with oil prices. And now, the largest employers in the region are really in education and healthcare sectors. As Gifford mentioned, oil and gas is still really important from a wage perspective because they pay the highest salaries. You don't have as many people working in that industry, but their salaries are still very high. And what you tend to see in areas that are more service oriented, dominated by education and healthcare, is you tend to see flatter but more stable growth. And we've actually seen that in our home prices over the last couple of years. Is the growth has been more modest, more steady, and slightly below the nation. I think one of the things that surprised me a little bit is I think based on the average income in the region, home prices are a little bit higher here than they are in comparable markets. And that's what surprised me when I moved here. It's just, for the average income level, home prices here are higher than normal.
So I guess I guess it was Monday, the governor made an announcement about a tech company, Schoolmint, that was relocating its operations from New York and Miami, I think, to Lafayette, and those were decent salaries. And it was not a huge number of jobs, maybe 100 or so, but about an average of $75,000 jobs. So that seems like a hopeful sign that we in recent years we have been attracting more tech companies. Do you see that continuing?
Yeah, I think that is a really good sign. I think we've got a good tech base in the region, and that's an area that we can see some growth going forward. The other area that I think is still prime for the region is the healthcare sector, and specifically innovations in healthcare. I think that Lafayette's well suited, given our proximity and where we're located in South Louisiana, to really have a very vibrant, innovative medical center area. And I think that, if we can attract some initial investments to really start that growing, I think we've got an opportunity to really make a significant impact. We'll see how the merger with Lafayette General and Auctioner ends up working out, but I think that that's something, again, that could be a net driver for the region going forward.
Great, some hopeful news.
Ben, there's been we talking about restaurants. I think some people are worried as cases are rising if we're going to go back to phase one. If we went back to phase one, would that be kind of a knock blow for some restaurants? I feel sorry for them. They're on the front lines. They're taking a brunt of all this. Could they handle going back to phase one?
I think it would be extremely tough. I think if they were forced to go back to phase one, then some of those numbers that we mentioned earlier in terms of the 1 in 4 closures would probably start to become a little more of a reality. So I think that would be pretty tough on them.
Interesting.
So I'd really like to, my Alexa. So these are the things that happen when you're doing virtual meetings. I forgot to put her on silent. I'd really like to, these are eye-opening and unprecedented numbers in all of our industries and in Acadiana. So, let's look ahead at recovery. And maybe Gary, could you talk about, so in the immediate future, there's potentially the end of or lessening of the unemployment benefit. But in addition to that, what are you looking ahead at potential roadblocks to recovery or obstacles to recovery and bright spots for recovery?
Yeah, so kind of hitting at what I mentioned earlier, I think one of the bright signs was between May and June, when we went from phase 2 to phase 3, we saw a significant number of job gains in the region. So that's a positive sign. I think the two things that give me reason to be concerned about what we might see is, one would be the reduction in the extended unemployment benefits, just because it's providing so much of an income support to people that you're going to see a significant reduction in their ability to buy goods and services. And so that can limit what happens. I think the other piece that people should keep in mind is, any economy, any local economy is also dependent on what happens outside of our area. So, Gifford has mentioned this a couple of times. You've got the global demand for oil being low. And so that means regardless of what we do here, we're dependent on what happens elsewhere. And so I think in this particular time where we have a huge amount of uncertainty from COVID-19, we could shift into phase 3, shift into phase 4 in our region, but not experience the growth that we might otherwise have if other areas around the US or other areas in the world are still continuing to really struggle with containing the virus. And so it just means that a lot of our future is really outside of our immediate control because we're dependent on what happens elsewhere.
Gary, is there a hangover process, or I guess a hangover items after in the recovery? I've had people tell me that inflation is going to go through the roof, or the national debt's going to skyrocket. I mean, what's the hangover of all this, I guess?
Yeah, so I'm not too worried about inflation at this point in time. I would say I'm a little bit more concerned about the national debt. If you look, because of the CARES Act and the stimulus that was provided, essentially the federal government provided a stimulus plan which is almost equal to the amount that they spend in a single year. So we're going to have a record deficit on an order of magnitude that we haven't seen before. And where people are typically worried about that is it can do a couple different things. If the government is essentially borrowing more, it could drive up interest rates. So it could make it more costly for all of us to buy goods and services, especially big ticket items. I don't know to the extent that we might see that. I think the other concern is and I'm not passing a judgment saying it's a good thing or a bad thing, but we've essentially borrowed from the future. Right? So we borrowed from the future to finance the stimulus. So at some point, the generations in the future are going to be consuming fewer goods and services because we've borrowed against them. Mm-hmm. So, that's kind of the trade-off there. And from an economic perspective, we may think that's a good decision, but long-term, it could have some consequences.
Jennifer, we haven't picked on you lately, so I'll go ahead and get you a question. Recovery-wise, what is the future kind of look like for some of the state's kind of smaller rural hospitals? They kind of get lost in the shuffle a little bit. Do you think there'll be some smaller hospitals go through some financial struggles in the coming months?
That's been a risk for many years. And obviously they were able to access some care funds, but it is hard when you don't have a system or someone else to rely on for financial support during these hard times. To give you an example, when we were in phase 1, our revenue was down 30%. Mm-hmm. So if you're a small rural hospital and you're basically living paycheck to paycheck, it is very hard to make it through those times.
Talk about. I want to ask about drilling in Louisiana. You talk about the rigs being down. Just basically look for the price of oil to kind of stabilize a little bit to kind of get some more activity going in the rest of the year.
I mean, that's what it's going to take. We need oil to be, really probably above $50 in order to see companies willing to invest anywhere in the United States, really, to start going out and drilling. I mean, you've got, some that have the acreage now that they're able to produce at these lower costs, so they have obligations they're having to make. But again, it's really important to understand that does not mean that anyone's going to drill here in Louisiana. Particularly the legal framework that we have in this state drives every company, or just about all of them, particularly in South Louisiana, away from our state. There's a general belief in the industry, and not just within the industry, but within the investors in the financial community, that if you invest and drill a well in South Louisiana, that the state of Louisiana, a local government, or some private landowner is going to sue you at some point. And you can take those same investment dollars and go to Texas and drill and produce the well without having to worry about, this environmental litigation, and certainly not having to worry about the government coming after you like we do now. And so until we change that as a state, until we fix that issue, and then we have some tax issues to do. We've got a constitutional amendment to address that this session. Until we fix that, we're going to continue to lose investment dollars and drilling activity to every other state in the nation, which is going to continue to cost us jobs. And particularly in Acadiana and the service industry, it's going to cost us jobs. It's going to cost us companies. And the part that I'm most afraid of is when we lose that oil and gas industry. We lose these $100,000 workers, the people that have grown up in the culture of Louisiana or Acadiana. We start losing our culture, because I appreciate the diversification that we've got in Acadiana, and it's great to have other industries here. But the oil and gas industry is still the backbone, and it still plays a large part of the culture of the community. And once that's gone, you don't get that back. And that should be more, what we're fighting for, more so than anything else, is to maintain that culture that makes Acadiana so special.
So I have a question that, each of you may want to weigh in on. We're in a time of transition, on many different levels. And one question that people have been asking is, so is this the new normal? What does the new normal look like? Is the new normal people working from home? So in each of your areas, are there things that you're seeing that are really going to fundamentally change? What does the new normal look like? Not everybody at once.
I'll go first, and I'll just say I am not a fan of the term new normal. If this is the new normal for the hospitality industry, then we're in a lot of trouble. And we have to continue to strive forward with the opportunity to, I think, meet again safely. We've shown we can do that with the youth sports market, and we have some larger facilities that can handle smaller crowds. So I'm not saying we're ready for that now, but we have to start moving towards that. I do not believe long term that all of a sudden meetings and events are going to all go virtual. I know I'm tired of Zooming. I think a lot of people are tired of that. You can't match the physical, to be able to sit next to somebody and have a conversation and maybe have a drink or two in the evenings after the conference is over. So short term, I think that's going to continue, but long term not. But they're saying it'll be 3 or 4 years before we have a real recovery for the hospitality and tourism industry. But that's sort of.
I will say, I think that restaurants in Acadiana were really great during the governor's stay-at-home order, when restaurants, were so limited, at coming up with ideas and promotions and really streamlining their takeout processes. So I think they're creative. I think they can think outside the box. So what about the rest of you? Are there things that you're seeing that are, I know I don't like the term new normal either, but I don't have another one.
Kristen, I'll be happy to answer next. I'm with Ben. I'm hoping this is not the new normal, but it definitely is the interim normal. And so, what we're seeing is, at one time we were as high as 500 visits a week virtually with our physicians, and people don't like that. Like Ben mentioned, they'd rather meet in person with their physician and be able to talk to them. So even that's decreased over the last several weeks. We struggle with trying to make connections with our patients when we're wearing a mask, and even going as far as looking at buttons that have a person's face on them so that you can really see the whole face. I've seen jokes where people say the mask says smiling, so at least you're trying to make that connection with your patient. It really has changed everything. Of course, we do have workers that probably will work from home, those that are not directly taking care of patients, like finance or accounts payable. Those folks may work from home for a much longer period of time, because we have learned from that they don't have to be in the office. So I hope it's not the new normal, but it will probably be here for at least a year.
Is there a concern that we had gained a lot of ground with regard to people making preventive care and annual visits, and insurance companies really stressing those things, and staying in shape and doing your health assessments? Are we worried that we're really losing a lot of ground there?
Absolutely. Two prongs. One prong is just with the delay and the defer of procedures with the first wave, as well as today. So today, both Lourdes and Lafayette General are having to postpone inpatient cases that require an inpatient bed because we need those beds to treat patients. So whereas you may have came in for a mammogram back in March and that got delayed for 6 months, maybe now you have a much more advanced breast cancer than if we had caught it 6 months ago. So that absolutely is a concern that we're seeing.
That's really scary.
As far as the new normal is concerned, the question I think that I get asked the most, is when are we getting back? When is the industry coming back? And to me, we always look at demand. And when is demand going to come back to February of 2020 levels from a global standpoint? My wife's a travel agent, so I use her as a barometer a lot because I think we always think about vehicles and gasoline, but cruise ships and airplanes consume a lot of fuel and the oil that we produce in this country. So I'm looking at her and saying, okay, how are people traveling? Are they ready to go back on cruises? Well, cruises are all shut down. Are they traveling to Disney? How many, is Disney open? That sounds crazy, but that's when I can say that, when people are ready to get on an airplane with their grandparents or when they're ready to go on a cruise ship, that's when we've returned to normalcy. And that seems like it's so far away right now to get back to that level of comfort. And I think it's probably going to require a vaccine, and it's probably going to require a cure, and it's probably going to be for everyone to feel comfortable with that before everybody's willing to take those steps. And for the industry, that's when I know that demand will be back. That's when we can start seeing, I think, significant price recovery and understand that there's stability within the industry again.
So Gary, given that, if people are social distancing, if we're wearing our masks, if we're flattening the curve, what are economists projecting as far as how long this recovery could take? Are there any guesses?
Yeah, so I think, earlier this year when we had the president declaring the pandemic, I think it was in March, people were thinking maybe the end of 2021, because I think the idea was we can essentially lock things down, contain the virus, and we can reopen pretty quickly. And I think most of us have realized that's not the case. We're certainly seeing that in Louisiana, and we're seeing it in other states as well. So that just means you're pushing that timeline back. And I would agree with exactly what Gifford said. It really depends on, when do people feel normal again and they're willing to go out and do what they used to do. I think we'll get to that point. I mean, I think habits are really difficult things to break. And so, the Zoom meetings are great, and some companies are probably going to figure out that they didn't need to do as much travel as they used to do, but I think we're still going to travel. I mean, my own forecast right now, I think, if we're seeing something that's close to normal by the end of, 2023, I would be surprised. Generally what happens when you look at economic downturns is the negative effect happens really quickly, and the recovery, unfortunately, happens really slowly. Mm-hmm. And so, 2022 at the earliest, 2023 probably more realistic, I think, for all of us. But it depends on how quickly people feel normal. If we don't have a vaccine, we keep having flare-ups of the virus, and we keep shifting between phases, this could extend for a long period of time.
I'm going to choose to focus on that 9,000 job gain that you talked about earlier.
When I saw the number, that was really good, because it was a sign that, when people feel comfortable again, things might be able to turn around pretty quickly.
Mm-hmm. Yeah.
So.
Yeah. So, I think that we've gotten through most of our questions, and we have just a couple minutes left. If any of you have, you have a platform, anything that you want to talk about that we haven't addressed in your industries?
I just want to mention, we talked a little about what's in store for the future. Our recent forecasting calls for around $50 million of hotel receipts at the end of the year, which would be a 35% decrease compared to last year in 2019. That would be a decrease of $29 million, and compared to 2014, which is our highest year on record, that'd be $36.3 million difference in the negative. So hoping that it ends up higher than 50 million, but that's sort of our projections for our latest forecast. We're trying to look at see what our budget's going to be moving forward.
Kristen, I'd just like to add that, I hear all the time, hospitals must be making money. You're full of patients, right? Or you get all these government funds, so you must be doing well. And unfortunately, it's very expensive to take care of these patients. The remdesivir that's mostly used to treat these patients, we're spending about $100,000 a month on that drug alone. We've talked about staffing shortages and what that does. And so it's very costly. They have a longer length of stay. And if I could get one message out, it is A, mask up and take care of yourself to try to stay out of the hospital. And B, no, we're not, making a ton of money just because we have a lot of patients.
I appreciate that, Jennifer. Thank you for that. Anybody else with our last couple minutes have anything you want to add? If not,
yeah, I have one quick thing I was going to say. I know I've, mentioned a lot of numbers that are difficult to swallow. And one thing I want to point out is economic data always lag what's actually happening. So when you see something that comes out in the news today, that's something that happened a couple of months ago. And so a lot of the data that we're going to see in the next couple of months are going to be much worse than what we've currently seen, because we're going to see second quarter of the year data for 2020, which is going to cover, April, May, and June, which a lot of states were shut down. And so I don't want people to get a lot of anxiety because you see very, very dire economic data being released. This is telling us how bad things actually were. It's not telling us where we're necessarily going. And in fact, things are a lot better now than they were in April. So just keep that in mind as you're seeing the news over the next couple of months.
That's great. I'm so glad you added that. I think that's really important. And I think, optimism is really important. So unless anybody else has anything, I have a few closing remarks. First, I want to thank you guys for joining us, all of our panelists. This is a tough subject, and I really appreciate you joining us and giving your time and your expertise. I also really hope that the next time we do this, we get to see you all in person, because I really miss that. I also want to thank those folks who have joined us online. We're recording this and it's going to go live on our website. So y'all feel free to share it with others who may not have wanted to get up quite so early to watch it. And finally, I want to say thanks to our sponsors again, Hancock Whitney Bank, Acadian Companies, and AARP. Like I said, this is a really important conversation about the recovery of our community. And without you, it would not be possible. So thanks again to our panelists. Have a great day and the rest of the week.
Thank you, guys.
Thank you.